This is a self-reflection on my second virtual practical done on a lower extremity injury. Some improvements that I need to continue to make from the first practical to the second one and continuing. I really need to slow down my thinking and speaking as well, just to kind of make sure I incorporate everything I need to. I noticed that I was speaking really fast when talking to the athlete and giving her instructions and telling her what I thought. So I really need to slow down to make sure I don't miss anything. And for example, I felt like watching it, there were a lot more questions I could have asked about the history of the injury, the history of the athlete, what kind of things she experienced when it happened and after it happened. With that, I need to make sure that even though I may think I know what is going on and it's an obvious injury and treatment and, protocol, I need to make sure that I can stay open-minded to other possibilities and ask all sorts of questions just so I don't miss anything. And I think that would help if I would just take a deep breath and slow down with my whole process. And to go along with that, I feel like I could have done more with the functional part of the assessment. I had her walk and stand on her tiptoes and do squats and stuff like that. And I was in a very small room, but I think there was a lot more that I could have done or could have talked about doing, just to kind of gauge where the athlete is at. But I did see some improvements from the first practical to the second practical, such as I seemed to be much more confident, and I know I felt more confident in what I was saying, how I was assessing the patient, as well as talking to her about what we were going to do and everything. I felt like I was a lot more confident in what I was saying than the first time. I also felt like I was a lot more organized in this practical than in the first one. I went through the assessment in a much better way without jumping from one part of the assessment to the other and not having it flow. I knew what I was doing the entire time. Again, I just needed to slow down some with that. Coming away from this clinical class is I'm going to take away the fact that there's no one correct way to do something. I may make mistakes, but there's a lot of room to grow in our field, and I feel like this class has opened up a lot of opportunities to see how we can grow in the field that we aren't learning in all of our classes, and we can only learn through experience and from hearing from other people who are doing these things. There's a lot of different tools that we can utilize, a lot of evidence-based practice treatments, a lot of things that other healthcare professionals are using that we aren't, and we don't discuss those kinds of things in class, so we may not always see that they are available for us to use. But I know that we can utilize them and implement them in a way that makes us better clinicians. And I think that stepping away from this class, I have a better understanding of all those options that are out there for us and how to find them. And I think that's really important to becoming a better clinician.